Hello, my name is Michaela Clark, and I will be talking about the nursing image. So I have 3 objectives that I've laid out for this presentation. The first is to gain understanding of the diverse image that is associated with the nursing profession. The second is to obtain the knowledge to confront and address the negative connotation and image of the nursing profession. And lastly, to understand who projects the image of nursing and how we as nurses affect that perception. So what's the big deal with the nursing image anyway? Why does it matter? The nursing image does not only shape how nurses how nurses are perceived by the public, but also by our patients, and it also shapes the minds of other nurses. I'm going to talk to you a little bit about some different images that some people acquire about nurses. First, Cherry Ames was a book written from the 40s all the way to the late 60s. It was mystery novels written about this nurse trying to persuade other girls to pursue nursing during the war times. And this really made the public believe that women were the only ones that could really be nurses. This is where some of these ideas came from, that nursing was a woman's job. Then Florence Nightingale was one of the really first real nurses who called herself a nurse, and she gave us the perception that we are inferior to physicians, and this was based on mostly physicians telling her that we were inferior to them because we had no education and we were just kind of comforting the patients. Then we're going to talk about the uniform of nurses and how it's changed from the capes that women used to receive back when they graduated from nursing school until today, or 10 or so years ago, where we wear pajamas with cartoons on them to work. Now, in the past couple of years, many hospitals have transitioned into color uniforms, such as Lancaster General wears navy. But many other professions were upset because we wanted to be respected, and we were wearing cartoon clothing to work while other professionals wore suits and ties. Nurses portrayed on television. Nurse Jackie is a quirky show that was just recently released and aired. It's about a nurse Jackie, who is actually a drug addict, and it shows people that you really can be a drug addict, steal drugs from the hospital, and get away with it. Then we have Scrubs in the middle here, which pretty much showed the public that nurses are incompetent creatures, and there are many episodes where doctors often referred to the nurses being incompetent. And to go a little bit older, we have MASH on the right, and this is Hot Lips Houlihan, and she really started that whole idea of the sexy nurse or the naughty nurse, and that she was just nice to look at, and sometimes it was referred to that just her looks could heal. Then we're going to talk a little bit about a doctor's stethoscope. So a few years ago, while the Miss America and Miss Colorado pageants were running, there was a talent show, and this particular nurse came in with her nursing uniform, and this was her talent that she wanted to talk about. And she wore her nursing uniform with her stethoscope and read some of her emails aloud for the audience, and the performance was scrutinized by The View, and one of the co-hosts on The View, Joy Behar, even went to say she was wearing a doctor's stethoscope. So that just goes to show how far and how in-depth people understand the nursing role. So how does it affect us as nurses? Our perception of ourselves, the profession, and our coworkers comes from the public image, work environment, work values, education and continued education, and traditional social and cultural values. So all of those things combined really create our perception as a nurse of others and of ourselves. We often view ourselves based on the role of nurses, the knowledge that nurses obtain, and the attitude that nurses have. We all know of situations of some really great nurses that we can think of right away and some really poor ones, and sometimes just their attitudes, we can come to that conclusion just off of that one detail. So in a study that was done, nurses working in a hospital environment usually have negative perceptions of other nurses. Although in mental health areas, such as pediatric, in this specific case, it was pediatric mental health units, nurses have positive perceptions of their coworkers. And then senior nurses and student nurses both had these negative connotations and perceptions by other nurses brought onto them. So how does it affect healthcare, our patients, and society? Television, as we talked about before, depicts the role of nursing, often misinterprets the professionalism of a nurse. As we talked about before, there are many different ways that nurses show the role throughout the script or the character being played. Nursing is the #1 most honest profession in the United States, not just 1 year, but for 16 consecutive years. So that really goes to show that although there are many misinterpretations of what a nurse is, it's not misinterpreted that we are honest and ethical. There are opportunities to sit in the House of Representatives and to fill school boards to allow us to represent our roles and how we might illustrate how nursing contributes to healthcare. So that impact of having a firsthand example from a nurse can really change healthcare and change society and the perceptions of a nursing role and the nursing image. Attitudes impacts perceptions, and experience travels by word of mouth, meaning if you have a bad experience with a nurse as a patient, you're more likely to share that, hey, I had this terrible experience with this nurse, and all nurses are terrible. But on the other hand, if you had a great experience with a nurse, your nurse had a great attitude during your whole visit while you were in the most vulnerable state, that experience can also travel by word of mouth. Hey, I had a great experience at the hospital. You should go there too. And social media both has the opportunity to represent and misrepresent nursing. There was a study done that was showing how technology is really a key role in healthcare now, and it's only going to become more important and pertinent in healthcare, and how we need to be able to keep up with the technology to be able to keep up with the best ways to treat and care for our patients. But it also goes as far as just being able to represent ourselves on social media and represent what the nursing field is really about. So to wrap it up, Florence Nightingale, we're going to bring it back to her. She has a quote that I really love and admire, and it's, "I attribute my success to this. I never gave nor took any excuse." And I think throughout all the studies that I read, the majority of them said at the end that it's really up to us as nurses to represent ourselves. You can't have somebody else, have a doctor represent nurses. You as a nurse have to represent yourself, because we're the only ones